KRVFM, the heart and soul of San Antonio. Dr. Doug back with you. Our second guest on our Saturday conversation is none other, as I promised, none other than San Antonio Mayor Ron Nirenberg. How are you, Ron?
I'm doing great, Doug. How are you?
I'm doing fantastic. I'm doing fantastic. I'm doing a lot better today after the Mr. Biden's press conference yesterday.
Yeah, there's no lack of leadership now, thankfully, as we're getting our country on a unified agenda to stop COVID, among other things. And hopefully that means that our country will be united as we move forward to recovery. We know we need it in every city in the country, including San Antonio.
Absolutely. So it just baffles me the number of naysayers and actually the excuses they come up with for not taking the virus. Some people think they're going to turn into Martians or something because of whatever, and just that every time someone does this, it just creates more and more hurdles for us to because we're close, but it's like we're stuck in the mud right now.
It is, and and everyone should realize and understand that the longer this pandemic is delayed, and the longer it takes for us to get to some semblance of herd immunity, which we are nowhere near at this point, the more prolonged and difficult our recovery economically will be. Our community is fully open. Schools are back in session. Businesses are operating. Events are happening. We've got a big football game or a few big football games in town this week, in fact today. But if things, if folks are forced to, stay home because they're sick, or folks are in the hospital, or heaven forbid, schools have to shut down because they just can't get enough staff since they're quarantined, our economy really starts to fall back and slide from the recovery that we have been seeing. And so it's in everyone's best interest not only to protect the health of themselves and their family members, but also to get us closer to a community goal of herd immunity so that we can get our economy back churning again, and that's going to benefit everybody in the long run.
I agree. Now this Delta variant, it appears to be worse than the first iteration of the COVID.
Well, I'll reserve any medical comments for the professionals, but what is readily apparent and what they have been saying over and over again is the Delta variant is much more transmissible and contagious. And so that means that if you are unvaccinated, if you are vulnerable to severe disease, the Delta variant is going to find you. And when it does, you better be protected. And that means for most of us, and in fact, the vast majority of the population who is eligible for the vaccine, protect yourself with the vaccination. It will prevent serious illness and death. And for those who are unvaccinated, it's that much more important that we encourage our family and friends to do what they can do to protect themselves, get vaccinated, and everyone, regardless of vaccination status, in close quarters, especially indoors, ought to be wearing masks.
So I know we can't do mask mandates in San Antonio, but in your opinion, should just as a rule, should we go back to wearing masks?
Well, we are in schools, and the health directive is in schools they should be requiring masks. That is a directive. It's again got the force of law, and the governor has attempted to interfere with that. So has the AG, but there are court cases underway right now, including all of the court cases that are ruling on the merits. So that is still in place. The mask mandates in schools, as is city and county facilities. So we do have some level of mandate in those areas that we can that are still being battled out in courts. And then, of course, the Biden administration and federal government has been weighing in and lending their strength to health mitigation efforts as well. But regardless of that, Doug, the ultimate tool to end this pandemic is, of course, vaccinations. And the vast majority of folks are eligible. Those who are 12 and up, they should go get vaccinated. They should complete their series, which in most cases, the Pfizer and the Moderna means 2 doses and potentially a booster after it's authorized by the FDA. But keep in mind, 20% of our population is ineligible because they're younger than 12, and we've got to protect them as well. and that means doing our part.
Absolutely, absolutely. Now, when do you think we'll see some of the effects of the from Biden's press conference? You know, with the contractors to the federal government, federal employees, and all of those. You know, they've got a vaccine mandate, or they've got to be tested regularly. So when do you think we'll see some of the effects of that, of those new policies?
I think we're seeing it immediately, and the Pentagon has had their own regulations in place for defense personnel. We've had some mandates with federal and other government employees for some time now. The Biden administration is not fooling around when it comes to ending this pandemic, and so they are pushing, again, every lever they can to get us to herd immunity, and that unfortunately means, for some cases, they have to be required to take the vaccine. So I think you're starting to see that immediately. Of course, there is now a business mandate for businesses that have employers that have 100 employees or more. And so that's underway right now, and you know, I think there's some businesses that are waiting for details of that, but I know of many businesses, Doug, here in town, small businesses included, that have already put in place their own vaccine mandates because they know it will protect them, their employees, it will protect their customers, it will also help to keep their business operating. So they've already put that in place. With the president now weighing in, it provides every business some justification for doing that, so there's no sense in delaying. This is important for business, it's important for economic recovery.
Absolutely, absolutely. Now, tell us about the pop-up clinics. Are those still around, going around from Metro Health?
Yes, they are. Yes, they are. And, you know, we want to make sure that we're taking vaccines. We know that people have trouble with access. Not everyone has the opportunity to drive down to the Alamo Dome or your private clinic or a pharmacy. So we're taking pop-up clinics wherever we can, and we work with different nonprofit organizations, community centers, and we set up pop-up clinics for a day or two to make sure that vaccines are readily available in every corner of our city where there are people, where people need it. And so if you have a community organization, a community center, a church that would like to schedule a pop-up clinic, please call our Metro Health line. If you want to get connected, you can simply call 311. We can get Metro Health to coordinate with that center or that church or community organization and schedule a pop-up clinic. And, of course, we have our Alamo Dome clinic running again, our mass vaccination site. It's running Wednesdays, starting Wednesdays through Fridays in the evening. And those hours will likely increase once the boosters become authorized by the FDA.
Now, is there a timeline for to approve the boosters?
Well, we were hearing probably towards the end of September.
Okay.
That's a little bit unclear at this point, but you know, it's really just dependent on the FDA. That I think the initial estimate of third week or fourth week in September might be a little bit ambitious if you listen to what Dr. Fauci was saying. But
right.
Regardless of that, there's, you know, after you receive your second shot, you're fully vaccinated. If there is a booster required, you know, the guidance thus far has been you got to wait about 6 to 8 months after the second shot. So everyone who is waiting for a booster, hang tight. You're already fully vaccinated. We'll get that information and the availability out to you as soon as we can.
Awesome. So, I mean, once again, though, I know I say this to you all the time, and I really, really mean it. You have done just a fantastic job. I mean, I'm just amazed at your resilience and all the roadblocks and everything that you have gone through that they put in front of you, and you just keep knocking them over. And I really applaud you, and so does the rest of the city. We're proud that you're our mayor. So continue to good work. I do have something I want to ask you about. Since we got all not about the Delta variant, but about this, about the abortion a law that Abbott signed last week. What are your thoughts on that?
Well, again, the Abbott administration, Governor Abbott, and I would say Ken Paxton, and largely the one-party GOP-controlled legislature has not been taking care of issues. They've been making up problems, forcing solutions to problems that don't really exist. I think you will find that the bill that was passed with regard to abortion will be challenged and will be successfully challenged. but let's face it, we are not out of the woods with the pandemic. We're not out of the woods with regard to fixing our electrical grid. We certainly need some sensibility and bipartisanship with economic recovery and
healthcare, access to healthcare.
And the state legislature in these special sections has done everything in their power to ignore the real issues of Texas and interfere with the rights of women, of families, and of residents in general.
Because I just don't get this. Basically what he's done is turned Texas into a vigilante state where we got Texans neighbors going against neighbors. And I just don't understand how they even came up with that.
Well, again, I think that this is cheap politics in the midst of pre-election for the state's leadership, and people should be taking notes as they go into 2022. We need leadership, and we're not seeing it in the state right now.
Thank you. Well, that's well said, because it's just horrible. Now, not one single bill about the electric grid. You're absolutely right. And the other problem that we have here is just access to healthcare. I mean, the healthcare exchanges here are much more restrictive than they are in other states.
You're absolutely right, Doug. We have one of the worst uninsured rates in the state of Texas, in the United States. We have tens of thousands of families in our own state who are going without basic health care because the state has refused our fair share of taxes going towards Medicaid and basic health care access. Meanwhile, we're being interfered with when it comes to ending this pandemic and having some basic health mitigation strategies to get on with this 18-month pandemic. You have to question the priorities of the state leadership at this point. And, with regard to the rhetoric being used to advance bills like you've seen, which is the most draconian women's health bill that has been passed in the country, using the phrase having the right to choose, at the same time, using it in a way that obstructs people from basic health care mitigation for this pandemic is just absurd, to say the least. And again, at the time in our country and in our state where we need leadership, we're seeing the exact opposite from the highest levels of office in our state.
Well, he did. He said yesterday. I don't even like saying his name, but the governor said yesterday that he's going to end rape. He said that in a press conference, and I did some research when he said that, and I found out that there are approximately 10,000 rape kits that have not been processed, and so. If he were really interested in doing something to prevent that, you would think he would start with the rape kits and getting those processed, so that people people who have been abused can find justice.
Well, it stands to reason if the governor thought he knew how to end rape, he would have done it 20 years ago when he was still in office as an attorney general. We all know that that's absurd, and we all know that saying something like that is a slap in the face of every rape victim in this state.
Absolutely.
And again, we should be taking notes as we go into election season for state offices.
That's what we got to do. We got to, whatever the restrictions are, we just have to overcome those and make sure that we get out. And if you're not registered, there's no better time to get registered to vote than now.
And let me say one other thing, Doug. This is a solemn day in America. We are recognizing the 20th anniversary of a day of infamy for this generation that we will never forget.
Right.
And in that moment, in 9/11, 20 years ago, our country was reeling. I mean, we were in a pain and despair. We were afraid for the future, and we had leaders on both sides of the aisle step up and bring this country together for unity. We have been facing a 2-year pandemic where every family in this country has been reeling from crisis that we have not seen in over a generation. Leaders in this country, regardless of party, would be standing together calling for unity. In our state, you have leadership partisan leadership, signing bills preventing people from voting, placing obstacles in front of people for voting, some of the most vulnerable members of our community. That's not leadership. That's not unity. That's divisiveness at the worst time, in the worst era. And if we remember anything from 9/11, it's that we need to stand together, and we're not seeing that in this state right now. And I hope things change.
Well, you know, I hate to say this, but you know, the former president, he did not participate in any of the ceremonies today. He didn't.
Well, again, I would say that today we should be remembering the fallen. We should be remembering the first responders who rushed into the scene. Some of them from our city here in San Antonio.
Absolutely.
Celebrated a couple of days ago. We should be remembering the families who are still setting tables with empty chairs. That's what it means to, I believe, hold this day in solemnity, is to remember those folks who gave everything and who continue to, mourn the loss of loved ones. We should be standing together on their behalf and fighting for what they were fighting for, and that is the ideals of this country, standing together and advancing the idea of America, which is that everyone can pursue their lot, their happiness, and live in freedom and harmony. And that's not what we're seeing in this state right now. We need leadership to turn it around.
Thank you so much, Ron. We've gone a minute over. I apologize for that, but thank you so much for that. I really appreciate it. San Antonio Mayor, the Honorable Ron Nirenberg, the best mayor in America. Ron, you're awesome. Thanks for taking time out for me today.
Thanks so much, Doug. Take care.
I'll talk to you soon. Bye-bye.
Bye-bye.
KRV-FM, the heart and soul of San Antonio. That was, once again, San Antonio Mayor Ron Nirenberg, and he talked about all things San Antonio and the Delta variant. And, go get a vaccine if you're in a public place. Try to make sure you carry a mask with you. Take care of yourself. Take care of your families. Dr. Doug's show, Saturday Insight Show. Thank you so much. We'll be right back in a minute.
It's an on-demand rideshare option that works on the user's schedule.